everyone, I'm Rachel and welcome back to Conversations with Dental Friends, the podcast for dental professionals who want to squeeze every last drop out of their career. Whether you're looking to grow where you are, pivot into something new, or finally take that leap that you've been dreaming about, you are 100% in the right place. This week I'm chatting with Amanda Jackson, and honestly, she is a walking, talking dental encyclopedia. She's been a nurse, a manager, a teacher, a course creator, and she's driven the kind of change that has literally shaped dentistry in Northern Ireland and way beyond. And yes, that nearly makes me emotional because of the impact she has had. It has been unreal. Quick one before we get into it. If you're enjoying the podcast, or even if you've just stumbled across it and think, yeah, this feels like me, please hit follow. It just takes 2 seconds, but it makes the biggest difference in helping us reach more people who need these conversations. Plus, it means you'll never miss an episode. All right, let's dive into my chat with Amanda, where we get into all things dental nursing, cross-infection, and my favourite topic ever, self-improvement. This podcast is sponsored by Dura Dental, a company that's been setting the standard in dental innovation for over 80 years. Whether it's their ultra-reliable suction systems, world-class hygiene solutions, or cutting-edge dental imaging technology, Dura Dental supports dental professionals who take their craft seriously. Check them out at duradental.com because excellence starts with the tools you trust. And of course, a huge congratulations to Oratol celebrating 60 incredible years this year. Happy birthday, Oratol. Here's to many more years of innovation and excellence. I truly couldn't imagine the dental industry without you. So happy birthday from Conversations with Dental Friends. Welcome, Amanda Jackson, to Conversations with Dental Friends. Thank you so much for being on the podcast today. Our oracle for all things dental nursing and beyond. So Amanda, thank you so much for being involved with us in our podcast.
Well, thanks very much for having me.
You're welcome.
I'm delighted to be here.
Take us right back to the very beginning. How did your journey into dentistry start, and what does your career look like now?
So probably like a lot of people, I fell into dental nursing.
We all do. Into dentistry generally.
So I was at tech, as we called it back then. I was at tech doing my A-levels because my school didn't have a sixth form.
Okay.
And not loving it.
Yeah.
You know, and couldn't decide what I wanted to do.
I know.
And then my sister saw the advertisement in the Belfast Telegraph.
I love that everybody else always knows what's best for us.
Yes.
And it's always the Belfast Telegraph, because that's exactly what happened to me and so many other people. They were like, that would be good for you.
Totally.
Yeah.
So it was for the dental nursing course in the School of Dentistry, and I applied and managed to get in.
Yes.
So my journey in dental nursing just progressed quite slowly. I think at 17 you think you have to ram stand.
You do.
And everything has to be right, and I don't think you appreciate that life's a journey.
Exactly.
And things just evolve.
17, so young.
So young, you haven't got a clue. But you think you have. So I graduated, which was brilliant, and I got a job in the School of Dentistry. Oh, actually, I was meant to do hygiene.
Were you?
I applied and got accepted into Edinburgh.
Wow.
At that time, and I was looking forward to going, and then I didn't go.
You didn't go?
I didn't go. And I decided to stay at home and progress my career at home.
Yes.
So I got a job in the School of Dentistry as dental nurse. Absolutely loved it. Mainly worked in oral surgery and general anaesthetics.
Interesting.
Yeah.
Yeah.
And it was brilliant. And it was kind of at that stage that the trainee dental nurses then would have come in and
to see what was going on.
And would have worked. You had sort of 4-week, 6-week placements in every department. That's how they trained as dental nurses in there. And so when the trainees were in with me in doing general anaesthetics, and I was teaching them how to scrub up and how to gown and the layout of theatre, that was kind of where my love for teaching started.
Because I think some people are born teachers. Some people just know how to communicate and explain, because it's actually harder than you think to get that across, what's in your head to a person.
Totally.
And some people have that gift, which you obviously
I'm not
have.
sure that I have, but I teach people probably the way I like to learn.
Yes.
Which everybody's a different type of learner.
Sure.
But I think dental nursing is a very practical skill.
It is. And that's one of the things that I like about dentistry generally. It's so practical.
So practical.
There's always a cause and effect.
Yeah. So when I'm teaching, I like to do it practically.
Yeah.
Because I suppose that's what I started off doing in
Absolutely.
theatre.
Absolutely.
So I suppose that's where my passion ignited. And then I did my oral health because I still had that little hankering.
Toe in the booth. Yes.
So I did my National Exam Board for Dental Nursing, oral health, and loved it. To be honest, I just love dentistry.
Yes.
I get very excited about
yes.
So I did it and loved it. And then I became a National Exam Board examiner.
Okay. And how did that evolve quite quickly for you?
It did. And once I sort of realised that I wanted to teach people, I did my further adult education teaching certificate quite early on.
Yes.
It was a flog, I'm not going to lie. And back in the day when you had to go.
Is that similar to what we were talking about earlier there, off the book, off record? So that's is that more like a general teaching qualification, similar to something like Open University or something like that?
So it was a City and Guilds. It was 2 nights a week for 3 years.
Oh.
Yeah, it was
in person.
In person, and you had to do 30 hours teaching on top of that. And that was back in the day, the acetates.
Okay,
Yeah, it wasn't a wee PowerPoint.
How can you factor oh my goodness, I used to love an overhead projector with the film and the pens. That would make me very happy to relive a little moment of that.
Well, maybe a little moment.
Yes, not like all the time. So how did you factor that teaching into your clinical life then, initially?
That was nighttime as well.
Nighttime too, right, okay.
Yeah. So it was a commitment at that time. Now I was young enough and fit enough
to go for it, yes.
So I taught in the further education colleges what I could grab, what hours I could get to get those 30 hours up. And then I realised I loved the teaching.
Yes. And did you just approach them and say, "Hi, my name's Amanda. I really would like to teach someone. Do you have anything that would match my skills that I could?"
Well, at that time, depending on what age you are, Rosemary Gervin and ran the Belfast Met.
Yeah. I remember a few people chatting about Rosemary.
So they were very good.
Yes.
Rosemary was very encouraging, and I was very lucky to get the hours with them. But I also did the Bangor School of Dental Nursing. I've also taught in Uri. I've taught in Portadown. I've taught
the travel aspect on top of it as well.
I've taught in lots of different places.
Yes.
But that was quite early in my development, I suppose.
Sure.
And then I worked in the City Hospital Relief of Pain Clinic, which was a night as well.
Oh my goodness. Yes.
So lots of experience of just getting different settings.
Yes.
And learning from that, I suppose.
I suppose that's what makes you that's what makes you a good teacher, is the diversity of that experience, that you're not just in one place with one group, because everybody does have those different learning styles, as you were saying. So you're adapting your teaching all the time. And I think sometimes whenever you put yourself out to do something, as in you're doing it in the evening on top of your real life day job, it does make you a bit more determined and serious about it, because you've got to get it just
when you've got to be motivated to do it. And I think I like a challenge.
Yeah.
And also, if somebody tells me that you're not going to be able to do something.
Oh, there's nothing. Yes.
There's nothing makes me want to do something more. So I absolutely was determined. So I was really blessed, I think, probably in my career, in that I got the job in the School of Dentistry as the dental nurse, principal of dental nursing.
Fantastic.
So that was a dual role, which was a manager and tutor.
Yes.
So I managed within there and also trained the dental nurses in the scheme that were coming through. So again, absolutely loved that role. I was there for nearly 10 years doing that role, and
I'm sure you've seen many fabulous stars come through in that time.
I mean, I just love seeing somebody come in with little or no experience.
Yes.
And start that journey and then flourish and become confident and confident. And it's just so rewarding.
It really is.
You know, and that is my joy.
Yes, absolutely.
So I absolutely love that. But the training scheme, as you probably know, it stopped in 2005.
Okay.
So then I just became a full-time manager.
Okay.
Which also had its rewards. But
yes.
It didn't bring me as much joy. It was certainly challenging.
Yes.
And I do love challenge.
Yes.
But I suppose at that time also I started to have quite a young family.
Okay.
And I was looking for what was the right option for me.
It's going to be maybe more flexible around home life. And of course, yes, very different, but it's maybe not giving you that, it doesn't light you up in the same way, I suppose.
And I just missed teaching. I mean, I loved my job, don't get me wrong.
Yes.
So you love the challenge of it, but I just missed the teaching element. And at that time, a role came up in NIMTA.
Yeah.
And I was lucky enough to get that. So I worked within NIMTA, and then I taught in the further education colleges
as well.
And sort of just balanced life. And then another opportunity came up to develop an infection prevention and control and decontamination program with the undergraduates in Queen's.
Yeah.
So I just grabbed that with 2 hands.
And
I did that right up until 2023. So I was doing that for a very long time. But that sort of gave me a taste, and sort of NIMTA, of working with the whole team.
Yes.
So prior to that, I suppose I was only working with dental nurses. But then actually it's such a bonus to get working with the whole team.
Do you find that there are differences whenever you broaden out to that whole team approach on how people are taking on that kind of information? Obviously,
yes. Well, everybody's role is different in the process of all of those kind of things.
Yes.
And yes, it does. I mean, I'm an advocate for team training.
Yes.
I think it's paramount. It's so important in how we respect and appreciate everybody's role.
I agree.
So I think it's really, team training is vital.
Team training's the way.
Yeah.
And then that took you all the way to 2023. And here we are now.
2025. Yeah, that's a quick.
Yes, a whistle stopped her through. So I think it's probably good to have that management experience on top of everything as well, because again, to give that perspective on the full team and that side of things is really beneficial. You've really carved out a space for yourself in professional education within dentistry. What was that part of the plan, or did it evolve naturally over time? I know we've kind of answered that a wee bit.
I think it's a bit of both.
Yes.
You know, I don't think you can. I think once you decide something is your passion,
yes,
obviously you want to thrive within that passion, you know. Yes. But then, as I say, I tend to grab every opportunity that comes to me. I'm just one of those people that loves a challenge. And not always the right challenge. Yeah. I give things a go, and then I try to learn from them if they haven't been the right thing.
Exactly. It's more like feedback. And I was just actually talking about this with somebody else earlier on how you're going to do so many things in your life, and even bringing back to that, trying to have it all figured out at 17. You're going to do so many things in your life. Some of them are going to be in this column, some of them are going to be in this column, but to know where they land, you need to give them a try.
Yeah, of course.
And I think that I would be similar as well. If it's going to be something that makes you feel like you're pushing yourself, it's worth doing it.
Well, nothing ventured, nothing gained.
Exactly.
And we do learn the most from failure.
Yeah.
I mean, success is lovely,
isn't it?
But we do learn more just the hard part, and give back as much as I can and encourage as many as I can. I think that's sort of my mantra.
And I think when you're passionate about it, you just want to give other people the information. You just want to say, like,
I want this. Come on now, get excited.
Yes. That's how I feel.
Yeah.
That's how I feel about hygiene and perio. Whenever I find something out, I'm like, stop everything. I need to tell someone. I need to let them know. And
I mean, I'm not the sort of person who you want to go to a conference, because I go to a conference and I come back so enthused and so excited, and everybody's like, calm down.
But there are people in Minna that need to get excited about certain things.
Well.
And we are those girls.
Yeah.
We might need to be.
I'm a one who, you know,
It's niche. It's niche to be excited. But I love it.
You see, I think infection control
Yes.
and health and safety are such a big part of the dental nurse's role. And I know that a lot of people find them boring, but they're essential.
It's the bedrock to our
really
job.
is.
Patient safety. Our safety, but also patient safety. And what we want to do is give the patient the best possible experience. And that's the cornerstone of that.
Patient safety. It's always been high on my priority. You know, a lot of us get into bad habits. So, I mean, myself included. I always start off my lectures with, I'm no angel up here. But as I said, infection control is such a big part. It's just something that we all have to prioritise.
Because I wouldn't like to see what it's like if it's not prioritised. Like yes, of course, everybody can say, oh well. But if it's not being done, and we actually see the real life repercussions of it not being done, and it's not just a story, and it's not just this person did this and it didn't work out that way, like that's so impactful for us. Maybe not even just for our careers, but for our health and our lives. So I think it is so important. CPD and ongoing education seem to be huge priorities for you. Did you have to undertake any specialist training to make that move into teaching and training others?
Well, yes, I did. So I suppose the oral health was sort of my first taster of a post-certificate. And I love learning new things, but it has to interest me, which I think is probably everybody. There's nothing worse than sitting in a lecture and it not floating your boat. So once I did that, and then I suppose in my management role, I had to do additional qualification for that. And then I did, when we knew that sort of HTM was going to be coming in, I did all with Eastwood Park, all the sterilizer additions. In autoclave operations and user and all of those. And then I was really lucky then when I moved to NIMTA, I did a module with Glasgow.
Okay.
Hospital, actually. And then I went and did sort of long distance qualification. It wasn't quite open university, but it was with Dundee for my fundamentals in infection control.
Wow.
So, yeah, tricky to balance all of those things while you have a young family. But,
absolutely.
But worth doing.
I'll link as much as I can there in the show notes for anybody that's interested and wants to do wants to do something similar to that. It's a lot to really wrap your head around how much scope there is there.
I know.
To take on that then becomes filtered down. I say this all the time whenever I've had like a lot of friends who have come into practice as trainee dental nurses and they're not qualified just yet. I say all the time, I'm like, the scope of this is insane. To not know what you're going to be questioned on with such a broad scope is quite daunting. And I suppose to then teach that broad scope, or whenever you're thinking about cross-infection control, whittling all of that down into manageable, digestible thing is a lot.
I mean, it's a tricky one. And also, one of my big things is operator training of dental nurses is to be an operator of the equipment in the decon ring. But that level isn't taught when you're doing your dental nursing course. Generally,
yes,
I think it's important that trainee dental nurses actually go on and do operator training, because it's a big role.
Is that something you would sort of take on as a lead? Like, so if you were a lead dental nurse, that would be a bit more implied, or is that something even you can be a lead dental nurse without having?
I think I just mean for
Right.
all dental nurses.
Yes.
It says you've got to be an operator in the decon room.
Yes.
That's our role. You need to do operator training. And then you need to do additional to be the lead decon.
So you would have dental nurse qualification and then ideally operator training.
Yeah, I mean, it's a 3-hour course.
Yeah.
It's not a big course. Yeah. It's just a level of knowledge that you need to appreciate.
I wonder how many people actually do that. Hopefully, probably not enough.
I know I'm probably over passionate about it. Now I remember where I was when mad cow disease hit Louise. I mean, I tell this story to everybody. I can remember I was standing washing my instruments. The radio was on.
Yes.
And it was all about mad cow disease. And that has shaped my career because I can remember standing thinking, oh my goodness, could how I've cleaned these instruments impact somebody?
Yeah.
That was the key change, the key shift in my being, I think.
Yeah.
Because, and thank the Lord, mad cow disease did not come out stage in the way that they, at that time, thought it was going to.
But it was very scary at the time.
That time.
And I'm sure a lot of the way that we do things now has been shaped by things like that generally. You know, of course, COVID is another one that changed our jobs entirely. And I suppose there has to be some sort of continuous training because of all of those things.
Microorganisms are very clever, much more clever than we are, and they're always ahead of the game. And that's why you can never have enough infection control training. It's just such a practical thing to embed into your working day, but it's not an easy thing to embed into your working day. And so that is where a team approach is so important, because you've really got to work with each other to make it happen. To protect the patient and keep risk low.
Yeah. And I think, I mean, we'll talk about this in a second, but I think as well, there isn't maybe enough respect's maybe the wrong word, but like headspace given to within a practice to how vital that is. And first of all, that takes a certain amount of time to do that. I mean, I definitely have been a person that's been frustrated on the end to have sent patients home because I haven't had instruments.
And that's the right thing to do.
Yes, and I've had a couple of patients where like I don't have that. I'm not happy to see you. It's not fair to see you and charge you if I don't have all of my hand scalers through that I want. So we're going to have to reschedule your appointment. But I'm making that decision selfishly for me. And yes, where I was working at the time, I'm paid per patient, so I am taking a hit if I don't see that person. You know, if you don't have the knowledge that you need to have as a full team, or if you're not confident as a lead in the training that you've been given to really put your foot down and say we're not seeing anybody. You know, it's impactful and it's nice to be able to have that evidence where you can go and say.
I think it's so important. Additional training is so important, and you know, I think dental nurses should equip themselves with that knowledge.
And how would somebody do that?
That's quite important if you're just trained by the person who's always done it. It's so important to have additional training.
Absolutely.
So that everybody is up to speed. And in my current role in NIMTA, I feel really blessed because I get to do in-practice training, and I get to go out to practices to do infection control and decon training.
Yes.
And that's a real privilege for me to go in and be open and honest about how we do things and how we can improve things. And you can always improve something.
Yes.
Is the way I look at it.
There'll always be a takeaway.
Whether that be mask hygiene, which is my burr. You can always improve something, but to go into a practice that's people's safe space, that's your real niche. So for me to be able to go in and go, right, let's talk through how we can make things, improve things.
That's quite a vulnerable place for a practice to come into, because you can think, God, what if I'm doing it wrong?
They probably don't realise that's what I'm going to do. When they ask me, but I like to talk through as I'm teaching that. I like to say, so you tell me what you do, and then we'll talk through, you know, how you should improve that, you know, what little tweaks you can make. And again, that's what I love, because interaction that you get with other people. And to me, there's so much online training. And don't get me wrong, it has its place, of course it does. But infection control is so practical. And I just think it's really hard to read that in a book and then think, how do I implement that into my routine?
And for the operator training, how would a person do that extra operator training?
Well, within, and I know we're going to get to talking about Euro within NIMTA currently later, but I offer an operator, and it's only a 3-hour course. Now, of course, you can do further ones. You can do the Decon Lead in Eastwood Park, and there are other companies that I think you definitely should do those. I also run a course for user managers, just like, because like you're saying, the instruments disappear, and you're like thinking, what is she doing? What is that dental nurse doing with
What's
her?
happening?
But in actual fact, the practitioner is the person who's using the instrument on the patient.
Yeah.
They are the person who needs to know what the process is and be confident that the dental nurse is doing the process to the letter.
Yes.
And is rendering those instruments safe to use on the next patient. That is what is so paramount in all of it.
Oh, I want to do them all now already. I want to. It's like, I need to know everything. No, I think I'm so passionate about something so bored. But I think it's good. I have worked in practices before where the joke in the practice is, oh, the principal never goes in the decon.
For anyone who listens to this podcast, take a wee pop in.
Exactly.
Just pop your head in. Have a wee look. Maybe ask for a wee refresh. Just what goes on in here?
Because we are, exactly as you say, we are the people that are using the equipment.
I mean, it has to be a team approach.
Yes.
Of course, because that's what it's all about. I just think, remind yourself, it is a process. It is quite a lengthy process.
Yeah.
So working out what your patients are coming in for is paramount.
Yes.
Depending on how much equipment you have.
Exactly.
All of those things are taught in the user manager
training
course. Yeah. And in the operator to a certain degree.
So you've done your further education and teaching in lots of different many ways, and that's obviously something that will continue to evolve with you over time. And I imagine you're the first person to sign up, Amanda, for anything new that comes out. You have that Simon Sinek Start With Why, and that has obviously been a huge fire in your belly to move your career forward, and I think that's really interesting. This episode is sponsored by Lighthouse Dental Company, your partner in creating beautiful, functional dental practices. From equipment supply and servicing to full refurbishments, including flooring, cabinetry, electronics and plumbing, they manage the entire project so that dentists can focus on what matters first, their patients. You can explore how they bring practices to life at lighthousedentalcompany.com. Dental nursing, Amanda, as a profession has really come such a long way, and we're seeing career paths that lead to practice management, treatment coordination, dental hygiene, dental therapy, orthodontic therapy is a fabulous new offering for us here in Belfast and beyond. But dental nursing in itself is an excellent job and an excellent career. Where do you see dental nursing evolving in the next few years, and what kind of roles or opportunities do you think could open up next?
Well, I think dental nursing is at a really exciting junction.
Yes.
Within Northern Ireland. Because you mentioned orthodontic therapy. That has definitely been a career highlight for me.
Oh my goodness. I'm buzzing about orthodontic therapy. Will be for the next 9 months. I'm so excited by it.
Well, actually, I'm smiling from ear to ear. I'm just so pleased. But definitely it's been a very big challenge to bring it here. But I just am really passionate that there are more career pathways for dental nurses.
Yes.
That was one that I was able to
Champion.
And I'm delighted that it's here. Our first cohort started in June. If anybody follows on Instagram or Facebook, you'll have seen them starting. It's really lovely to see that.
How many spaces are available on the course?
So 6 normally. Great. We've actually got 7.
Oh, lovely bonus.
Yeah. We have 2 girls coming over from Ayr.
Fabulous.
Yeah, which I was not expecting.
And is that similar to other programs there where they will have their trainer in practice?
Yeah.
And then they'll do a day or a couple of days a month here, and then they'll go back to their practice, be mentored.
Very mentored program. Yeah, it's 1 year, and they do a 4-week study block,
Yes.
which I have to say was really intense for them. I mean, tough going.
Yeah.
Take my hat off to them. And they studied really hard during that time, and then they go back and work within their practice and are mentored, and then come back for 8 study day. And then they have a practical and a Viva and an exam at the end of the year.
Whenever I was talking to Becca, our orthodontic therapist we've had on before in season 2, a year is a challenging amount of time to take on all of that information really for them.
Totally.
And
And
work
they're
full-time.
still growing. It's like everything. Once they
Yes.
qualify, that will be when they will learn.
Take off.
Really.
Yes.
So I'm really delighted that is now a goer
Up and
in
going.
Ireland, which
Yes.
is fantastic. I think I would love to see more dental nurses developing within their own practice.
Yes.
I mean, I know that lots do,
Uh-huh.
but I don't mean just doing a post-qualification. I mean actually
Body. Yes.
actually implementing it
Yes.
within the team, within the working environment.
Yes.
And that takes really forward thinking and being open to change, which
Yeah.
is really hard.
And do you mean like radiography or digital scanning or
All
things
of
like
it,
that?
yeah.
Yes.
I mean, alginate, fluoride application, all of it. Giving oral health advice,
Exactly.
giving smoking cessation.
Yes.
All of those things
Uh-huh.
can be really done by the dental nurse, and
Yes.
really that gives us an additional role, and
It's very
empowers.
empowering.
Yeah, it empowers us. And I mean, one of my big things is four-handed dentistry,
Okay, yes.
because I trained to do four-handed dentistry when I was a trainee dental nurse, and I loved it.
Yes.
Because
It's like a flow. Yeah.
just so
Yes.
amazing.
Uh-huh.
And I think it's one thing in the dental practice that is really not utilised.
Yeah. Do you think we're losing it a bit?
Oh, definitely.
Yeah.
And it's shown to reduce stress within the team.
Uh-huh.
It empowers dental nurses because they have a wee bit of control.
Yes. Exactly.
We all like a bit of control.
We do, yes.
So I would love to see four-handed dentistry making a big comeback.
Yes.
And I think that would be absolutely amazing, because I just think dental nurses would thrive in that environment.
And that would be maybe some sort of additional training then.
It would be.
Yes.
Yeah.
Yeah.
But it would be as a team.
Uh-huh.
And that's what I think so important.
Uh-huh.
Because, like I said, we all like a bit of control.
Uh-huh.
And the dentist is the person in control, and you have to
Yeah.
let go a little bit with four-handed dentistry.
It's hard whenever you're in the surgery, because if you don't work with the same person all the time. And I have a fabulous friend and colleague called Lenny, and whenever we were working together, that was like one mind, and
Yeah.
she was working with me like 3, 4, sometimes 5 days a week.
Oh, lovely.
The dream scenario. We didn't need
That's
to talk to
already
each other.
it's
Yes.
there.
Uh-huh.
Yeah.
And to be able to have that like in a dentistry setting, how is that not the norm?
I
Because
know.
that's what you want. I don't know why we ever got away from that.
I know it is one thing that sort of, especially in restorative,
Yes.
because it just makes it so
With those
much
big
smoother.
cases,
Yeah,
yeah.
especially now that there's so much more
Yes.
cosmetic and big cases going on.
I feel like we've went backwards there for some
A little bit with that, but I'm an advocate for that.
Yeah.
Um,
Oh, I will be as well.
yeah.
Yeah.
I just think it's a really good skill. Dental nurses are very intuitive.
Yes.
Once you've done a procedure once, they know what's coming next.
Yes. Because
Or right on the ball.
repetitive. It is
It is
repetitive.
repetitive.
And that's the thing, that's the silver lining of repetitiveness, is that it's well rehearsed.
Totally. I always say most dentists have their favourite burr.
Yeah.
So that would be one of my things.
Yes.
In terms of promoting, I think the post certificates or the post qualification courses are brilliant.
Uh-huh.
I think I developed one myself.
Okay. Tell us more.
And I'm really hoping that it will get accredited in the next couple of years, because I'm quite proud of it.
Yeah.
I'm to sing my own hymn sheet there.
Absolutely.
So it's for dental nurses who work alongside a foundation dental nurse or dentist.
Okay.
Because again, that is
Yes.
kind of a unique experience.
It really is.
And you've got to be able to support them quite a lot at the start. And then when you've got to let go of that,
Yes.
As they grow, it can be quite challenging to do that as well. But I think that's a really unique role for a dental nurse whenever you're supporting a foundation dentist. So we run that again within NIMTA because the foundation dentists come through. So
yes,
it's a really good course.
That's fantastic, because I do feel like if somebody naturally falls into that role with a foundation dentist, and then they always, each year, they nearly take on the foundation dentist.
Yeah.
I can think of a few people.
Some people are good in different scenarios, and you do have to be a certain type of person to have those patience to be able to guide somebody without actually saying anything, because there's a patient and it's important to support them in the right way. So
I think that's brilliant. That's a brilliant course. So you can do the course already.
So yes, it's not accredited course currently.
Yes. But if you were somebody in practice who had that little desire, or you guys as a team were thinking of taking on a foundation dentist, that would be available to you as a nurse,
for your nurse to come along. And it's based on all the NEBD and post qualifications, so it's written to their spec.
That's wonderful.
It's another really high relevant that, which I love.
I always think with all of these postgraduate things that you can do as a dental nurse, do you ever think that there will be a time when the general dental nursing qualification swallows those up? So you maybe, rather than waiting to do your post qualification in radiography, the radiography is part of your foundation? Or do you think the scope is just too big?
Whenever you're doing your dental nursing qualification, there's a lot. There's a lot to learn, and you should learn it.
Yes,
because
you can't cherry pick it.
You can't. And as I said to you offer, you can make your role as a dental nurse as boring or as exciting as you want.
Yes.
And I think when you do your dental nursing course, learning the muscles mastication, you're thinking, why am I learning this? Learning the nerve supply, will I ever? But for me, that's actually, I would have been sitting thinking, what nerves he anaesthetizing me for doing this? And I would have been thinking that as we would treat the patient.
Because you have that background there.
Learning all that and then developing it is really important. And radiography is quite a hard subject. It is. And there's a lot of regulations around it. And to learn all of those to the depth that you need to know them. Yes, you learn them to a little bit.
Yes.
But to learn them, I think that would be hard. It would be a lot.
Yeah. It would maybe make it more, I suppose, full-time degree course.
And there's some of the colleges over in England have done that. And I used to be the external examiner actually for Letterkenny. And it's a university course.
Yes. Wow. I didn't know that.
Yeah. I think it's a challenging one, that question. I don't think it should be, because I think, like we're saying, when you qualify, that's when you start learning.
Yes.
And you build those skills, and then you do your post-certificate, and you find from doing your under or your pre-reg, you're discovering what you like.
Exactly. Not everybody needs to be qualified with lead dental nurse.
No.
Because that will be one person's lane. I'm thinking about Natasha, a dental nurse that I worked with in another practice, who's went on to become a manager of the practice. But cross-infection, HT 105, that was her bag. And for certain people, that really will be.
Yes, I just think you're sort of finding your feet and what floats your boat. Who knows what the future holds for dental nursing. I think currently a really exciting post position, and I think people are recognising the scope that the dental nurses can do, and I think if we can embrace that and encourage it a bit more in dental practice, I think there needs to be more of a sort of salary reward goes on in dental practices, because at the minute we're not retaining dental nurses.
Exactly.
I mean, that's
that's
one of the biggest challenges. It's because we're not promoting it as a career. And I think if you're taking somebody on as a trainee, you need to say, listen, you're going to do your qualification. Once you get that, you want a year just to find your feet, and then we really love you could do this. We really want somebody that's able to more patients are being treated with special needs in dental practices. You know, we'd love if that's your bag, or is oral health your bag, or is radiography your bag. I mean, it's fantastic.
Yes.
I worked with special care, and that would be one of my passions as well.
Yeah.
I absolutely would love dental practices, and I know it's the time and the money and all of those aspects. But I do think there's a lot more out there that we can be doing, and it's
You can have
time.
a diary open. We've had that in different practices where the diary is open for all of those things that you were chatting about, and how fabulous for the whole team to be able to
Pull together
have that mindset and be open.
I mean, if your chair is free
Yes.
one afternoon, I know, imagine if you had a spare dental nurse. That would but wouldn't it be so lovely if that dental nurse could bring some patients in just to give oral health to?
Yeah.
Wouldn't it be so amazing if that dental nurse could bring in a group of school kids? Let me show you how to brush your teeth. Let me tell you all about this. I just think, oh my goodness.
Yeah.
Or, you know, bring them in to do alginates for
Yes.
whatever.
Bounce around.
I mean, I just think, wow.
Uh-huh.
I mean, you could be so utilising your chair. Listen, utilise your chair.
Exactly. Amanda, something that really stands out about your work is how you reformed infection control, your fave. I'll be honest, it's something that a lot of people see as a tick box exercise or leave to someone else in the team. What would you say are the key things that principals, associates, and even hygienists and therapists should actually be across and be thinking about, even if they're not physically in the decon room every day?
Oh,
Big question.
that's interesting. Well, we've touched on a few things. I suppose, like I said, infection control, it appears so easy.
It does.
You read it on
Yes.
paper, it appears so easy. But the problem is that it's not.
Uh-huh.
And we all have natural habit.
Yes.
And we all like to scratch our ears, top of our heads, rub the old nose without even knowing we're doing it, or push our glasses up, scratch a few other places at narrations. And we don't even know we're doing it because they're just natural habits.
Yes.
But that has to be curtailed in the clinical environment.
For sure. I would hope none of us are doing that in a clinical environment. You would hope.
Sorry, you'd be surprised. Everybody who knows me will know this. Nail polish.
Nail polish.
The old nail polish. I know. Never mind false nails, we'll not go there. It's hard. It is hard.
Yeah.
And I mean, those are there. Those are there for a reason. There's a reason we have to come into a clinical environment in a specific way.
Yeah.
And I know that some of us think, oh, well, it's dentistry and it's a bit lower risk. I mean, we closed over COVID because it wasn't. There is a risk.
There's risks there.
So it's there for a reason.
Yes.
So I think it is really important that we remember all of that.
Yes.
And then that we learn how to put that into practice. And I mean, one of my biggest bugbears would be materials on instruments.
Okay. Yes.
You know, let's talk about that little gem.
Get the gauze out.
You know, it has to be white there, because we don't have ultrasonics anymore.
Yes.
In Northern Ireland. I mean, they can be, but most practices chose to get rid of them when we got our washer disinfectors.
Yeah.
So materials on an instrument will not come off in a washer disinfector.
And once it's on,
it has to be wiped off.
Yeah.
And that's a team approach.
I
mean, you cannot get away from that. You have to work as a team to wipe the instruments at a time.
If that instrument's not wiped at the time, is the instrument useless? No.
The problem with reusable instruments is that they have a protective coating. Right. So if you use the burr brush or a green scoring pad to take that material off, you're breaching the integrity of that special coating.
Okay.
And then when you put the instrument through the cycle, it gets rust and pitting.
And then
it goes useless because well, the problem is the cost. The cost implication that has to a practice. If you were doing that routinely, you would be throwing instruments out quite frequently.
Yeah.
And so that's why it's so paramount that you wipe it at chairside. I'm an advocate for cassettes.
Yes.
Because cassettes just keep everything in line. You have 20 instruments in your dirty box, all single.
Yes.
How are those instruments going into your washer disinfector? They're being scratched. And that's why cassettes are really helpful, because especially for mirrors, they're held in position, and that's where the operator training is so
Yes. So I was
mask hygiene is one of my big bugbears as well.
Should you change your mask every patient?
Yes.
Yes.
Masks are sold as single use. And again, that's what I love about doing in-person training.
Yes.
Because we can talk through your mask hygiene and your mask use. Because again, most people think that's low risk.
Yeah.
But actually it's not when you talk it through.
Yeah.
If during a patient interaction, you pull your mask down below your chin at any point, then that mask is contaminated.
Okay.
I mean, it's contaminated anyway by the aerosol or whatever or how you're treating that patient. But if you touch your mask with your gloves to pull it down for an interaction,
it's toast. I love that. I love that. But I think that's good. Amanda, you're also involved with NIMDA for people who might not be familiar with NIMDA. Can you tell us a bit more about what you guys offer and what your role looks like within their education programme?
Okay, so NIMDA stands for the Northern Ireland Medical and Dental Training Agency. If you're not aware of who they are, they're an arm's length body of the Department of Health and primarily train medics and doctors once they graduate.
Right.
So for dentists, that's in doing their foundation year, and then if they choose to go into specialty or core, they can further develop it in into. And then there's me. And then my routine. And we are a very small team, but we are for continuing education for the dental profession within Northern Ireland, promoting learning for NHS.
Yes.
Really, to encourage that. A really small team, so we have achieved a massive amount. We sort of offer an academic year of courses.
And it gets released and then it books out. It's like getting tickets now to Ted and Spiegel.
Not quite. I mean, I'm really excited this year because we're running a conference.
Okay, where is the conference?
Am I allowed to tell you about that?
Please, yes, please.
So the conference is on the 17th of October, and we haven't had a conference for quite a few, since before COVID.
Yes.
And so this was sort of my goal, because you can't underestimate learning face-to-face and networking.
Yes.
And I don't think people appreciate the network, how important networking is, and just hearing, oh gosh, that's actually what we do in our practice, and it's a nightmare. And just that other people are in the same situation as yourself.
It can be quite lonely, I imagine. I know that we keep coming back to nursing, but as a late nurse, you have to be a bit of a ball buster in some occasions, and that's
just to regroup with people who are doing the same sort of thing as you is, to me, really important. So I was really excited to be able to put this. So we have a main stage, which is focused on diagnosis.
Right.
And then we have a parallel programme running alongside that for mainly dental nurses and DCPs if they don't fancy the main stage. And it's called Supporting Our Patient.
Great.
So the Chief Dental Officer is coming to speak up the Oral Health Improvement Plan.
Fantastic.
Yeah, really want dental nurses and hygienists and therapists to hear what the Department of Health, their plan is, what they thought they are. So Caroline Lappin is coming along, so we're going to hear from her, and the rest of the day focuses really on how we implement those things. So we're doing a bit of neurodivergent patients.
Excellent.
And then the afternoon session is dementia. We're doing dementia as well. And then the afternoon session is deaf and hard of hearing patients.
Wow.
And hopefully learn a little bit of sign language.
Oh my goodness, I want to come where there's still spaces.
Yeah, really, I'm overexcited about it. And the main stage programme is also fantastic. Obviously, it's more for dentists.
Yes.
But also therapists and hygienists could come along to it. So we're doing a bit about occlusion. And a bit about TMD. Then we have in the afternoon a joint session with Amanda Willis and Seamus Napier.
Okay.
Doing oral cancer and pathology.
Fantastic.
And that's going to be an interactive session.
Fantastic.
So really excited about that.
Brilliant.
So I don't know which session I want to go to. I mean, I will go to the dental nurses. But
that's really amazing that we can have that hands-on element to it.
Really looking forward to that, actually. So that's the 17th of October.
17th. I will put it in the show notes.
So we also have lots of hands-on courses happening. We have a perio course.
Great.
For therapists can come on that too.
Excellent. Yes.
We are also actually doing later in the year, it's actually early next year, we're doing a crown lengthening course.
Oh, fab. Yeah.
And we also have a 4-day oral surgery course
Brilliant.
on, which are on animal cadavers.
So yes, I've seen them here in Marlborough. Yes.
So that's really good. But then on top of that, we have all the normal recommended GDC topics and additions. And we'd really encourage, if you like face-to-face learning, to come along.
Yeah.
Because online isn't for everybody. It certainly is for a lot of people.
Yeah.
And that's wonderful. But our courses, I think, are reasonably priced.
Yeah.
Because it is for NHS.
Are there different price points, bands and things depending on your
discipline?
Yeah.
So
Excellent.
you can register with NIMTA and book on. It's quite easy to book on to all of our courses. So absolutely
Brilliant.
come along. So it's really good.
That's so exciting.
But in addition to that, we also have all our National Examining Board qualifications for dental nurses.
Brilliant.
They, again, aren't online. We're more face-to-face training.
I think
Well, there needs to be the
offer
offer both. And prior to us, there weren't very many people running the post-certificate course. It was a face-to-face option. And I was quite sad about that because I'm not a big online learner myself. And I think there needs to be, because there's courses for horses, you've got to find the right guy that suits people. So we have all of those running, and we have a practice manager's course.
Great.
I absolutely love. We've been running it for like nearly 20 years now, and it's a really successful course. So if anybody is an aspiring practice manager or has just moved into that sort of role, it's brilliant for them.
I think it's really good to have some sort of a qualification when you move into practice management. It's difficult, I think, especially for someone who's transitioning roles within practice.
Absolutely.
So to have that, again, that little bit of evidence behind what you're doing is important.
Dental practice management, which I love because it is a wee bit unique. We are unique.
Yeah.
We're special. So absolutely. I think it is important. And again, the learning that comes out of being with other people in the same situation, that's what I love. When the penny drops that this is actually the same for everybody, it's
magic,
isn't it? So we've lots of things going on that people hopefully will find. I'm always open to suggestions. I just say, and we're really also trying to, or I am also, our little team is trying to encourage dental nurses to come out of their comfort zones a little bit. So I don't know if you know this, but we run a sixth form event.
Oh, right.
So some dental nurses are helping us to run that, and that's given them an opportunity to not teach, but to show how to mix alcohol or how to do different little things that they have developed their scope of practice in, maybe like putting rubber dab on.
Yeah.
Or
love that.
Taking an alternate practice. So if you're a dental nurse out there and you think, I could dip my toe in just a little bit to see if I like that kind of thing, drop me a wee email. I'd be more than happy.
Yes. What is your email, Amanda?
Amanda.jackson@hscni.net.
Lovely, and I'll put that in the show notes as well. That all sounds so exciting. There's a lot going on with it. I love a bit of CPD. I'm a CPD collector. I know. And finally, you've already achieved so much and have become such a guiding voice in the dental nursing space. But what's next? Are there any goals or dreams on your radar that you just love to make happen?
Don't start me. Loads. The orthodontic therapy has definitely
that's been huge.
Yeah, really magical. So, but I'm also a suicide prevention trainer.
Okay.
And I've been for many years, and we run safe talk training within NIMT as well.
Wow.
So it's a very delicate subject, but I would love to see it embedded into all the curricula.
100%.
Because I just think it's a life skill.
It is.
Apart from within our profession.
Even as part of our medical emergency training.
Yeah.
Yeah.
I think it's a really, and it is a very sensitive subject.
Sure.
I don't want to get into that today, but I would really love to see that embedded into all the undergraduate curriculum. And then I would like, obviously there's still the gap, even if it does. It's so important so we call it Safe Talk training, and it's suicide prevention training. So yeah, do come along to that. It's free, but it is a 3-hour training session.
And anybody in the practice?
Anybody can come. Anybody. And I would really recommend that. I think it's a really good course. So I would like to see that developed a wee bit more. So if you come along to the conference and hear what Caroline Lavin talked about, have you read the new improvement plan?
Well,
I mean, I would love to see a role for oral health practitioners within Northern Ireland. That's my next
project.
Yeah. That's a level 4. So it's a step up. It gives dental nurses a real opportunity to have more patient interaction.
Yes.
Which I think is fantastic. So I would love to see that develop. I would love to see therapy come to Northern Ireland.
Yes, please.
Because on the back of if it came to Northern Ireland, I'm sure you're aware that a lot of places now do a therapy foundation year.
Okay.
So like the dentist foundation year. They can be mentored when they
and we really you want to be involved in that. We need that. I, as a dental therapist, was in practice a couple of the weeks after qualifying in practice, doing an amalgam filling at 10 to 6 in the evening
on my own
with no nurse. So so I think a foundation year would be well received, Amanda. Yeah, that would be.
That's on my radar.
Yeah.
Oral health practitioners is on my radar. What else? Watch this space.
I know exciting things will happen. I know that. Probably you haven't even thought of that yet.
Before I retire. Because I really want to be part of that. I think it's really exciting times. Please, if you're out there and you're thinking, I don't like this anymore, please think about how you can develop yourself in that area, because we really don't want to lose people who have amazing skill set.
I know.
And you just need to find yourself in the right place.
You do.
To develop yourself. And I'm more than happy to answer any emails that come into me. I'm always delighted to get a wee email, so please drop me one.
And it's that song, Don't Give Up on Us, Baby, because I have lost, not to the world, but to the world of dental nursing, so many brilliant colleagues, and they have left a massive hole.
Yeah.
And I wish they would come back. And I wish we didn't lose them in the first place. And we could explore that all day about the reasons behind that. But most of all...
And absolutely, if it's not the right thing...
Yes. Know when to say namaste and move on.
Absolutely. But have you thought about the past? And if you're in a not appreciated where you are, then it's just maybe not that place for you.
Somewhere.
You've got to find the right place.
Yes, exactly. Well, Amanda, I loved that chat so much. I think that was brilliant. We have got so many things to write in our show notes. I am beyond delighted to tell everybody about the NIMDA course, 17th of October. I think that's going to be huge. Some really great information about operator courses, some great courses we can do as clinicians as well to make ourselves more aware of what's happening in the decon side of things. And it's been brilliant to hear your journey. So thank you so much.
Thank you.
And thank you for everything that you've done for us as a profession and the brilliant things that are going to happen, especially for dental therapists. I love it.
And now I don't have control over that.
I know.
Let's just make sure everybody knows.
You're persuasive, Amanda.
I'm not.
Thank you so much. Wow, what a conversation. Honestly, I don't know about you, but I just find it so inspiring when someone dedicates their whole career to lifting others up simply because they love dentistry that much. Amanda has touched so many parts of the dental world, and if you know her, you'll definitely want to join me in giving her the biggest thank you ever. There's so much we've packed into this episode, so make sure you check out the show notes. We've linked everything from the NIMDA conference and the sixth form open nights to operator training, practice management, orthodontic therapy, and the training programme for foundation dentist nurses. I'll pop Amanda's email in there too if you've got questions, if you want to get involved, or if you just need some solid advice on moving into education. She's already been a huge help to me off mic. And if you're a dental nurse who's been thinking about leaving dentistry, I really hope this conversation has given you a reminder of just how valued you are, or maybe it's shown you that switching things up, maybe broadening your scope, adding new skills, or just changing your day-to-day could be the fresh start you've been waiting for. If you know a brilliant nurse, a practice manager, or a principal who could use a reminder of how much the dental team can bring, send this episode their way. You can find us over on Instagram at Conversations with Dental Friends, and I'm also there too at Homegirl Hygienist. I'm on TikTok as well. I'd love to hear what you thought about this chat. And that unbelievably wraps up season 2. A massive thank you to every single one of our guests over the past 12 episodes. Claire and Ben, Alan Clark, Siobhan Kelleher, Marie Sharkey, Rebecca Hamilton, Jack McHugh from Lighthouse Dental Company, our incredible season sponsor, Shelley Dawson, Aoife and Lucy, Nina Farmer, Maria Catney, Michelle Malloy, and of course Amanda Jackson for closing the season with us. If you've made it all the way to the end of this, thank you so much. As a little bonus for the die-hard listeners, we've got a special extra episode coming next week all about how you can apply for dental hygiene and dental therapy. Thank you so much again. It means so much to me that you've listened. I'll see you very soon for season 3.